Hello and welcome to Infused Conversations, where we talk about health, success, entrepreneurship, and the real work behind it all, one infusion at a time. Today, I have a good friend of mine, Joel Collins, who was a friend of mine during his residency over at the hospital that I work at as a nurse. Joel is a newly minted MD who's doing travel work, and behind it all, he is making memes of all the relatable content that we go through on a day-to-day basis that everybody loves to enjoy that. Unfortunately, a little too relatable sometimes. And he's always been a good friend who is there despite his crazy schedule, which we will get into today. He is always, the little bit of time he had, make sure to show up for the people around him that show him love. So Joel, thank you for coming in, getting on the podcast with us. You're one of the first official episodes. How are you?
Absolute pleasure. I can't believe, I feel like for you, this has been a little bit of a long time coming, which is, I don't know, it's cool to see your friends win. You know what I mean?
Yeah.
And I feel like you may not feel like you're winning right now, but just coming here and seeing everything that's happening so far, it's like, I was just like truly blown away. And I was like, wow, I know this guy. I know Tyler. Like, that's my buddy. He's got a spot.
Dude, you're saying that like you're not, like, I felt like it was the other way around for so long, because it was like, yo, this guy's literally about to be a medical doctor, and he's got this huge social media following, like, and just even like I remember when you came down to talk to me, and all of my coworkers were like, you know that guy? He's famous on social media. Like, well, how are you friends with him? Blah, 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 blah. So that's awesome. I appreciate that. It's really cool to kind of see like the turnaround there. But let's talk about you, man. I have a couple different points that we'll go through today.
Sure.
Obviously, we'll go on our own tangents, but tell me why medicine in the first place for you? What got you into it? How'd you start?
Yeah, I mean, I always tell this story, and sorry, Mom, I always, so, I just realized, like, I went to college at the University of South Florida, and I talked to a guy there who's like, I was undeclared major, and I just said, hey, I think I want to do medicine. He's like, well, you don't have any of these. You have none of the prerequisites. You have no volunteering. Your grades aren't that good. Like, come back. Yeah, good luck. You probably should do business or like something else. And I was like, all right, well, that sucks. So I kind of like went out, did some shadowing, especially in ER at a VA down there in Tampa. Really just, got my foot in the door and realized I had to like start getting the grades and whatnot, really buckled down. Did well for the next 2 semesters, dean's list, that kind of stuff. And then I went home and told my mom when I was kind of on the up and up. I was like, hey, I think I really want to be a doctor. And I always tell this story. She always gets mad at me, but I remember where I was sitting in the living room and she said, honey, you're smart, but you're not doctor smart.
Wow.
Yeah. And I said to her, like in my head, obviously, I was like, wow, I'm going to show you. And so I did that. And I don't know if the joke's on her or on me, because she has a son now that's a physician, and now I'm a physician, and life's rough at times, you know what I mean? Yeah, I mean, just blessed to be where I'm at. A lot of hard work, and that's kind of one of the reasons I just wanted to prove it to my mom. And I love people too. Like, it's kind of a unique job where you get to build rapport very quickly with someone and fix their problems. And I think I really love building rapport with people quickly. And I think just being able to fix their problems or even just give some reassurance is like a huge win for me at the end of every like patient interaction. So it's pretty cool.
You feel like within that there was a moment or multiple moments that you were on the verge of like quitting, where you were like, you know what I mean? Like, it seems like in the beginning you're more like, oh, I'm going to prove everybody wrong. Like, I'm going to do it. Yeah. Multiple people telling you no, even people extremely close to you being like your mom, and obviously in a joking manner, but nonetheless kind of you being like, I'm going to prove everybody wrong. Did that kind of ever shift for you where you were like in the process of it all? Like, I don't think I'm cut out for this.
Yeah, I think, even during my first attending shifts, I was like 30 patients deep in the middle of nowhere on an overnight shift. And it's my 4th night of 4. And I'm just like, they don't stop coming. And I was like, am I cut out for this? Like, is this what I want to do for the rest of my life? And I definitely remember questioning it then most recently when I was in Grenada on an island like 40 miles north of Venezuela while they were building a new building next to me, and I have earplugs in and I have white noise with my noise canceling Bose headphones trying to study for my next exam while they're pounding like 100 feet deep in the concrete for this. Like it was mental warfare down. I'm like, should I just give up? Like that'd be so much easier. I feel like, we pushed through, got it done, but there's plenty of times like medicine's a unique place to work, and plenty of times of self-doubt,
Yeah, I think it kind of comes with the process, like you said, just being in it in general. You said being so unique, you're not just like you said, the medical side where it's like where one person was like, you don't got the grades for it. But then in your spot, it's like, I don't know if I have like the mental fortitude. I got to help people. I got to do my own thing. Like I got to embrace my own kind of, personal goals and things that I have going on to get to where I need to be. And with all that, what sacrifices do you think most people wouldn't think about, like when you're going through that process? Things that you've done over your entire, what would be eight years of schooling, or is it even, I guess technically even a little bit more?
Well,
correct?
I mean, I did 2 years at a small school before I transferred, and then they said, well, none of your classes really transfer, so I technically did like 6 years of undergrad, and then I did 4 years of med school, 3 years of residency.
Oh wow, okay, so 13 for you
Technically.
Yeah. Wow, which is crazy. So a lot of times you see that a lot of doctors are ending up more like, I feel like everybody's like 8 years and you're good. Now I know a lot of people will do that, but do you see a lot of times more often that a lot of people in your cohorts were extending way past that 8 years, or kind of like a mix of both?
It's definitely a mix. I mean, I feel like the average MD that comes out that like isn't fellowship trained or whatnot, typically it's around like 3 years. Gen Surg is 5, but like, I mean, it varies. I think it's an average of like 30 to 32 years of age. People come out and they're fully trained. It just really depends on the specialty.
Okay. Why emergency med? What drew you to the chaos? Because as a med surg nurse, I go over there to help with an assisting hand, and I'm like, there's no way that I could do this full time. So what drew you in the first place, and what made you stay with it?
Sure. I think it's definitely the variety for me. I don't like, I thought initially that I wanted to do general surgery, but then I realized that like my patients are unconscious when I'm doing general surgery. So like, and I do like people, to a certain extent, obviously. And I think there's a certain, there's just a certain variety that you get to see with it. I think like, don't get me wrong, I think ER is a lot more difficult just because of a patient volume standpoint. And you're kind of you're a subspecialist, but you're also a subspecialist and supposedly in every single specialty. Like you need to know a little bit about infectious disease. You need to know a little bit about, okay, this is a gen surge versus GI issue. This is, and getting people to where they need to go and doing it safely it's so tough. It's exhausting. Like, and I feel like recently I've come to appreciate kind of what attendings do more so, because they like, am I sending this patient home to die, or are they going to be okay?
How do you deal with that? I guess we kind of talked about that obviously for a short period off, but now that we're kind of talking about it, I want to dive a little bit deeper. What residency, you know what I mean? Like, and I even said this, for me as a nurse, it's like I have you guys to depend on. So it's like if there's something that I'm confused about, like I have somebody else to kind of like, hey, I'm not sure, what do you think? Whereas it's like you are the final say. What's on your end? How have you been handling that?
Yeah, I think it's exhausting, to say the least. I have definitely called some of my previous attendings before that I know work night shifts, and I'm like, hey, I've got this patient. What do you think I should do with it? I think what it comes down to for me is, I always tell people, I don't think I'm like, I know I'm smart. Like I've got the degree, I worked hard, but I don't pretend I'm the smartest person in the room ever. So I always just assume, like, I basically just talk to my patients, I feel like enough time to make them feel comfortable with what the plan is. And if they're uncomfortable with what the plan is for any reason, then, I might have to dive back in and either do more labs or do more imaging but on a deeper level, I think it's more so about communicating with the patient and making sure you have that level of trust, meaning, listen, like, I can send you home, that's fine. If you want to go home, that's okay. But like, these are the things you need to return for. And I need to be able to like, not only have good rapport with the patient, but trust the patient. Mm-hmm. And I feel like in a whole new setting, especially like travel medicine, it's different because your patient populations are a lot different. So
I feel like where your strong suits in that lie is that you're honest with your abilities. I think that's where it'll probably go a long way for you. Whereas like and it's normal, I think, in medicine for all of us in general, you're over cautious because you don't want to do anything wrong. Like you said, we are people, we're people persons at the end of the day. Like we want to communicate with other people, help them get better, improve their lives, like those types of things. And so you're over analytic when you're like, am I doing all these right things? Am I making the right choices? And I think for you, based on what you've kind of been discussing, is you're not afraid to admit when maybe I don't know 100%, so I'll go that extra step to dive a little bit deeper. Or what's nice is you're honest and you have resources that you can go out to, like reaching out to your old, mentors within your residency, and just all those different things where you can pull your resources. Hey, I'm not too sure about this. I'm not certain. And at the end of the day, like you said, you do have the final say to be able to look at someone and be like, yeah, I'm not comfortable enough with you leaving. Or if you're comfortable enough leaving, I think we've done everything we need to, and letting them, make that decision, having that autonomy between, the healthcare professional and the individual that's receiving the care.
Yeah.
With that, any patient encounters, either crazy or chaotic or memorable ones, anything that sticks out to you in particular?
No, I think it's just really interesting because where I'm working now, I walked in and I had just told the oncoming attending, I said, I had this patient with this crazy, what looks like cancer pathology, right? And the attending looks at me and she was like, yeah, I'm pretty sure a company was dumping chemicals in the water for years because I catch crazy cancer on patients all the time here. And I'm like, what?
Wow.
Yeah, it's wild. Like, obviously without diving into like HIPAA stuff, but like it's the pathology out where I'm at now. I've never seen more tick-borne illness in my life. Mm-hmm. Rashes, body aches, and I mean, like I look around me when you walk outside this hospital, it's just all mountains.
Yeah.
And I'm like,
So it fits the bill of things coming in.
Yeah.
I'd say that's kind of interesting too. So, because obviously where we're at is a little bit more, I guess you would consider it like suburban. There's, we got the cities near us and everything. I've never even thought about that, where it's kind of like especially from your guys' end. For us, it's like we see the patient, you tell us the plan. We just, we're doing the face-to-face more consistently. You guys are going over the big details and diagnosing and all those things. I didn't even think about the fact that your different areas are bringing in such different patient, like, I guess overall, I'm trying to think of the word that I'm looking for, but just from a perspective of
pathology.
Just everything that they're coming in for is completely different than I'm sure a lot of the stuff that you were seeing where we were working at together.
Yeah.
How do you handle that? Is that just kind of part of like leaning into your skills, education?
Yeah, I think it probably comes down to more like from an educational standpoint, because when we study for the boards and stuff, we learn about different fish toxicities and altitude sickness. Now, altitude sickness we don't really see out here, right? Because,
yeah, we're right by the sea level.
Yeah, exactly. But we still have to know about all these different pathologies and stuff. So it's kind of unique when you do see something, I don't know, just different or out of the ordinary based on the area that you're practicing.
Do you, within your practice, do you feel like you've had any big, like, worth it moments? You have those moments where you sit down, like there's that one patient, that one experience with someone where you're like, man, like, this is really what makes it all worth it outside of, the material things.
For sure. I try to so when people are burned out in medicine, some of the best advice I was given was always, if you're feeling burned out, you need to spend like a little bit more time with your patients and like bring back a humanistic side of things, because being and feeling those, like being with your patients more is going to make you feel those more humanistic emotions, right? So, I try to spend, even if it's painful at times, a little bit more time with my patients. That is really important to me. But I had a patient the other day come in for, long story short, it was kind of more private issue to say the least. But when the family was leaving, the parents just stopped me, and they were just like, "Hey, you know, I just wanted to thank you for taking the time with my thank you for taking the time with my family member, because they haven't allowed a doctor to really examine them in 3 or 4 years, and I think you reinstilled in them a trust in physicians and healthcare people that may have been lacking for the past few years." And I think that was like special. You know, it was very quick, but you know, when you hear that, it makes you feel like you're doing the right thing for people. So
it's very touching. I kind of want to speak on that a little bit more and ask you the follow-up of what do you feel like people get wrong about emergency medicine, or even just doctors overall, right? You were just talking about that, you know, individual who they hadn't been seen in 3 years because they lost that level of trust. So what are some things that you feel people don't see about you to bring back that humanistic nature to, you're not just a servant, you're also still human at the end of the day?
Yeah, I mean, just from an ER perspective, I think people in the waiting room never see the 5 ambulances or the 3 codes that roll in, because they're not people that come through the lobby, right? There's other sick people that you're stabilizing and transferring out. And if you have the ability to be breathing okay, and, you know, your vitals are overall stable, you know, and you're okay in the waiting room right now, like, that's probably a blessing, because being on the other end of that, it's like you probably not want to be the person in the stretcher coding, you know, that people don't see that. People don't see that part. And like the amount of time we want to get to our patients faster, like we pride ourselves on that in the ER, is seeing people quick and getting people to where they need to go. But it's hard when this day and age, especially with all the health insurance stuff and things that are happening, like, you know, the ER has become more of a primary care. So we're overrun with figuring out who's actually super sick.
Yeah.
And sometimes that forces us to overwork people up, which may take a little bit longer. But at the same time frame, it's just that you just don't see what's going on in the background. And I think that's what people get wrong, is like, I hate having to apologize to people saying, "I'm so sorry for your wait. Like, you're very important to me. I was just dealing with some other very sick people," or "I just told this person that they have stage 4 cancer and are going to, you know, probably pass away soon."
Yeah.
You know, like, there's a lot of that happens in our jobs. So
I do have to say, I give you guys in the emergency room setting, any down from patient care tech to doctor, I mean, you name it, just any of you guys in there, billing, just those types of people that you're dealing with, because as you said, it's like you sometimes get lost in the scuffle as a human, and you deal with that all the time. I had my first experience similar to that recently, ironically. You know, med surg, we see a lot. We don't see it as frequently as you guys do. And I had my first moment, unfortunately, where we had a code with a patient. You know, things unfortunately didn't go the way that we were hoping for. And I immediately had to walk out the room, go directly across the hall, and my patient had poop from upper back to heels. And I, like, you laugh about it because it's like, oh, it's all you can do, you know, but I felt horrible because the family was there. It's the first time they're visiting for the day. And I was like, well, I can't tell these people. Like, I literally just had to deal with somebody who is dying. Like, that's what, you know what I mean? It's like, I have to now compartmentalize what just I experienced in my own head, that whole scenario. I now have to be sympathetic to you and your loved one while you're angry at me for it. And then I then have to later on, after this all happens, try and like process it. And that, I think, was the first large moment for me where I was like, I grew such a larger respect for all of you guys in the emergency room, because I was like, you probably do that every day. And it's like, that's insane to just be that emotional roller coaster that you go through. So more kudos to you guys and any of you listening that are in the emergency setting. I mean, it's just, that was rough. I will admit it. And I did go home that night and I was just like, damn, like that sucked. And that was one time.
Or did the ER just drop off that patient and they said that they cleaned them and they didn't actually clean them? Because we're accused of that a lot too, you know.
So listen, hey, as a floor nurse, no comment there. I don't want to stir the pot too much. I just getting started here. I can't create too much ruffle on the feathers.
Fair enough.
So I want to dive next into a little bit about your social media presence, what that means to you, how you manage it. I mean, because like I said in the beginning, in your introduction, I was super impressed when we first met. Where I was like, dude, this guy's literally going through residency school. He's telling me he's doing 4 or 5 shifts in a row. He's putting out loads of social media content, making people laugh, following up with it, commenting, doing this and that. Still trying to have some resemblance of a life where you're trying to lift. You know what I mean? For what you were allotted, we're doing extremely well with it. So I want to go a little bit further into it. One, tips and tricks for other people in residency right now are going into it. Whether balance. How do you balance life?
Yeah, sure. So I mean, I think my best advice is like, you're never gonna have that 50-50 balance. Sometimes that means that you're 80% in residency or 80% doing something, and the other 20% of the time you're just happy to get a 20-minute walk outside for fresh air. Like, that's kind of the name of the game. Is like, sure, that's what balance is this week, but my more recent phrase is there's a season for everything, right? Like, I'm not maybe in the gym as much right now, but I am studying for boards. I'm also keeping social media alive or afloat right now. And then I'm also working on starting a supplement brand. And I'm also working on doing things like this, like making time for a podcast and hanging out with friends. Or, definitely studying and getting ready for boards is like the big thing. But I also want to try to get back in the gym, and like, you're juggling multiple hats, and it's not always going to be perfect, but just doing the best you can, and then like managing at least 8 hours of sleep, like that's tough.
Yeah.
It's
just not realistic. I think that's too, like you said, I like the seasons for everything with that kind of that mentality around it being so busy. I'm starting to experience that now with, opening up the clinic here. Is you pick and choose when you got to do certain things. You put a little bit more eggs into that basket for a short period, and then we get back to the regularly scheduled program. And I think that's where, when I mentioned that about you, is you always have done a very good job of that, where you openly communicate and you're like, hey, things are going to be busy the next couple of weeks. When I have time, we'll connect. And you always were honest and stayed true to that. And I think that definitely goes a long way for sure.
Thanks. Yeah, I try. I'm sometimes a little too honest with my friends. I feel like, it's tough, but I don't think, like, even on like a family level, it's like people still don't understand like how much time it takes to do medicine, take care of yourself, and then like we schedule our vacations a year in advance, and they sometimes don't always overlap, and most of those vacations are used to go and see family. Like, I didn't take a real vacation in my entire medical career until last year. Sure, I was on an island in Grenada. It was vacation. No, I tell people it was window shopping.
Yeah.
Like, you weren't enjoying the beach, but maybe one time every 3 months after an exam, right?
Yeah.
But, it's just such a crazy balance. And
with that, and you talking about the balance of the relationships and handling all that, did you have a lot of support with what you were doing? How did you handle receiving support from your friends and your loved ones? And what did that even look like if you had support in your corner?
Yeah. I have a lot of support, I feel like. Even like you were one of my first good friends down here, and I don't even know how we really stumbled upon. I think I had messaged George a little bit, and then I got to know you through him, and I found out you did a lot of social media or like camera work, and I was like, bro, we could work together. And then kind of turned into lifting and that stuff. Like, so that's always been nice. I've definitely appreciated your friendship since I've been down here. But also family has always been super supportive. I have no one in my family that's in medicine. So, my girlfriend, she's been super supportive. Now my fiance, she's been really supportive, and things have been going super well from that standpoint. So I do have a lot of support in my life, which is great.
Yeah,
But
I was. I will say so I did. I did the photo shoot for Joel's graduation, his graduating class, as a favor to them, and also with Jefferson working for them. And you had by far the most amount of people there for you. That photo that I took, I was like, dude, this is like a huge family portrait. This is insane. So I thought that was super cool, and like just everybody around you was very energetic. What I want to kind of loop back into the social media side. What got you into that? How did that even start? Like in the midst of everything going on, was it just on a whim? Like what? Just go into it.
yeah, so in medical school, I had a buddy that I actually was one of my roommates who had a social media presence going in. So he kind of showed me how he did it. I was like, well, I can do that. So I started doing that. And, throughout med school, I was posting a lot, and it just kind of slowly gained traction. And then content has obviously changed from a lot of like med student stuff from when I was a med student to more like residency stuff. When I got busier with residency, I used to like make a lot of videos in med school with my face, but now from a time standpoint, it's really been hard to really put my face out there and put out like quality content from that regards. But I feel like it's kind of it's a plus minus in a way, because sure, I like to have my brand and my face on things, but at the same time, people don't always like to see a face. So I think sometimes a lot of people would rather double tap a meme that's hilarious because they don't know the account posting behind it. Whereas, I feel like with my face, sure, it's my brand, but at the same time, like, it's just so much easier to post memes right now.
Yeah.
I just don't have the time.
Yeah.
So from that standpoint, that's just kind of where I'm at right now. I recently opened a Shopify. That's brand new. So
yeah, I did see that.
So I'm getting some merch going on there, which is cool. My cousin has been helping me with a lot of designs and stuff on the background. So that's opening. Like I said, hopefully starting the supplement brand here soon. A lot of really cool, interesting things going on from social media. So
for sure. I want to talk a little bit about more of the new adventures that you got going on, big things, visions you got in mind. I think it's been awesome to see you grow the social media since we've been friends, and now you're starting to utilize that for different things. So tell me a little bit more about the supplement adventure that we're going on, what that's looking like, and we'll kind of dive a little bit further.
Yeah, no, I think as I've grown in my career, I've realized that there's a certain like few staples that are that are important to me. Like definitely 8 hours of sleep a night. That's super important. Definitely lifting weights and staying physically active. That makes me feel great. And then there's like certain supplements and things that I take. I think like daily multivitamins are super important. I take vitamin D, especially with the long winters. And then, I was in the gym and I would always take creatine and, whatever. I didn't really think too much of it. I was only taking it on days that I lifted though. But really when I started to like do a lot more shift work and I'd work 3 nights and I'd be exhausted, I take it in the morning before shift and I'd have like this brain fog that I swore, placebo or not, I believe it. I would take 5-10 grams of creatine and I would still be tired, but I'd be like very functional, and a lot more functional than I felt like I was before I took the creatine. So like I said, whether it's a placebo or not, I mean, there's great, good backed research.
I was going to say, I think it's just it's one of the most researched supplements out of them all. So we kind of obviously talked before the podcast. I'm very intrigued to see what you come back with, how that looks in your research. Have you been able to kind of dive into it at all really too much yet, or more like service level kind of stuff? And also your personal experiences that we're discussing.
Yeah, so from, obviously a personal level, I love the supplement. I think what was important for me was that make it easier to take, because I hate throwing it in a glass, mixing it with something, drinking it. Like, it's so easy to just put it in like a pill form or like a gummy form and like just quick, take it on the road, boom, go.
Okay.
Like, so I think that's where my head's at. I want to make like an easier accessible supplement. But right now we're just looking at things like, what's our minimum order quantity? How much creatine can you fit into a gummy? Is the gummy going to break down or be like like stupid little things, but things that are like important? And I think eventually I'm going to have that supplement hopefully within the next couple months. Okay. Hopefully I'll be launching something, but we're working on the different names for it right now. But I think like everyone knows that people who lift weights probably take creatine, right? But I don't think the everyday person realizes the benefits from like a longevity aspect, from a mental clarity aspect, and just from like a fatigue like standpoint. Like, I mean, you're literally taking a supplement that is providing cellular energy and metabolism, you know, supporting that.
Yeah, I think it's awesome. I like that you're doing spanning away, because I was like, when we talked about this before the podcast as well, but I was like, all right, creatine, like there's a lot, there's a huge market for it. So many people do it. I like that your twist on it is going to be in a gummy form, because just like from experience on my own, I do well taking pills, but like obviously patients in a hospital setting, as you know, or just even like day-to-day people, like some people hate taking pills. So if you can perfect something on like a gummy route, I love that, because it'll make it so much more simple for people to be able to be like consistent with it.
Fun to take too,
Yeah.
right?
Yeah.
Like, you know, everybody loved taking
day.
the Flintstone vitamins, right?
Yeah.
Why? Because there was like, they're kind of sweet, like sure, maybe a little chalky, whatever. But like when I take my gummy daily vitamins, I'm like, oh, a little treat before bed, and it's good for me, you know. And I'm like 33, so I'm like, it works.
Got to have fun with it.
Yeah.
I think keeping those things in mind, that's awesome. I like kind of the direction that you're going with that, to separate a little bit. I'll be very intrigued to see where you guys go, how that whole process looks for you. What are you noticing in the very, very early stages? For anybody on the business side of things, what are some of the things that you're struggling with? Are you partnered with anybody? Dive into those things a little bit.
Yeah, so I have a partner right now that's doing a lot of the legwork, figuring out what our like minimum order quantity is going to be. I think a lot of things that we're finding out are things like, okay, you can get $2 cheaper per unit, but you have to go to China or a foreign country to get it, right? I'm finding that a lot of people are overcharging for supplements that, sure, if you want to take like just a general powder form, you can do that. It's just more so like a convenience thing. And that's what I'm finding out with a lot of people is they don't like buying just the powder because it's just one extra step to take it, right? You're not dry scooping creatine. It's just like not a thing, right? So making it easier to take for people, making it a good flavor, those are like my main things. And then I think Made in America is going to be super important to me. And then there's like an NSW certificate, I think, which is just for making sure that like if like say Olympians or like professional athletes wanted to take it,
sure,
you have to get like a certain certification that says like it's allowed, it's free of any like performance enhancement or things like that, heavy metals, all of that stuff. And I think just locking down a supplier that has all of those certs can make me a great flavor, has like, it's just there's like a whole checklist of these things that you want. And then the last thing, the weirdest thing is all these people like don't send samples out. So like,
really, like just like struggling to get a hold of it from the companies?
I'm trying to get like samples from people, and I've only tried 2 different companies' samples, and I'm like, well, that was okay, but like, why didn't you send me samples of each one of your
different ones that you already
different
have
flavors? Yeah, So I think that's like a weird thing that I'm running into. Okay. I'm not just gonna buy a random flavor that I don't like.
Yeah, so you're keeping that quality there. Are you guys, how far have you dove into that rabbit hole? Because that's something like jokingly, and I think a lot of people like, they're like, oh, I'm going to do Amazon like sales and this, and I'm going to create a product and do it online. And like, you're giving a lot of like the back end stuff that actually are struggles. Is it like a communication thing with these companies? Are they just not willing to send it out? Like, and how have you been trying to pivot with that to get some of more the availability to different like samples to get the right product that you want?
I mean, I think it comes down to it's all like email based, and we've gotten on a couple like not FaceTimes but like phone calls and Zooms with some people, and I think like some of them are like, yeah, we'll send you other samples, you're gonna have to pay us $50. I'm like, okay, fine, like $50 for some samples, whatever. But a lot of it's like follow through, I feel like, on their end. We keep reaching out to people, but we're not gonna get samples from people that aren't following all those lists of things that we want, right? Yeah. So you may email us back, but your minimum order quantity is 3,000.
And then you're not even doing anything to entice me to want to pay for that 3,000.
Yeah.
So I've dealt with a lot of that too. I think on my end, now that I'm as like a new business owner learning that with like getting all the supplies that I'm getting the vitamins and minerals in, that's been a big thing for me, where it's like you said, some people, like, it seems like a lot of companies just kind of drop the ball on their communication, and it's hard. Like, I'm sure I also do it, and you don't even realize it half the time, but it's like, those are the things that you have to work through. So it's interesting that you're bringing it up in a slightly different fashion with what you're doing versus mine. Cause I found that sometimes communicating with certain companies, it's like, I'm literally telling you, I'm going to give you business. Like, I'm like, hey, if you just help me with these things, like, I can then in turn start paying you, and you're going to be making me money. And it's like, they still aren't, they're just dropping the ball somewhere wrong, whether it's intentional or not.
I feel like people are just flaky at baseline though, right? Yeah. So like if it's me and you talking, I feel like me and you are both like pretty genuine, like go-getter people, but like the average person probably isn't like that. So the average person sending them an email, they're probably like, they're not following up anyway. So it's like, whatever. If they come back, they come back, you know?
Yeah. Are you guys looking to eventually dive into more than the creatine? Is that just like a main focus? Like, where are your thought process with you and your partner that you're working with so far?
Sure. So we definitely want to break into like a little bit of a subspecialized supplement. It's not anything I can really divulge too much right now.
All right, a little bit of secrets. Cool. I like that.
But yeah, we're going to try to apply for some different, like, is it a patent or a patent on the idea initially, so that we can kind of move forward with it. And then, but it's a lot more expensive when you are creating an individually, how would you say, made supplement, meaning let's say you want to put multivitamins plus, I don't know, like vitamin D or like pre-workout or caffeine into a gummy.
Crafting it how you want. You're customized to the things that you're looking for.
I mean, your costs jump like 10, 20,000.
Oh, wow. Okay.
So
that quick.
So like, it's initially, I think what our goal is to like white label something and then expand upon that after that. So.
Okay. Yeah, that'd be awesome. I think too, and to tie back in your talks about convenience and just things that people are looking for, it's definitely kind of going down that route, at least what I'm seeing. Like, even patients that come in the hospital setting, I don't know about you from the emergency end, but patients that I get to kind of, like, I get to spend a lot of time with them and talk to them. A lot of them are becoming more like health conscious. They want to get the right information. They want to know they're getting it from the right sources. So I think it's awesome you're doing that with like trying to make it American made, be really open and honest about it, and not hit like your target audience isn't the bodybuilder or the super jacked athlete or those things. Like, it's things that are going to be beneficial to you and I, the general like person in the regular population, and you're making it easy to take. And I think that's one of the things that I'm noticing on my end with like the IV stuff. A lot of people are coming in as well, just for the simplicity of it. It's like, I can come in, I can get all the stuff like in one shot. I feel great. Like, and then we're good. And we, even from like a business standpoint, how we talked about, working alongside Umar, the same concept where it's like, if everything's in one place and it's convenient, like, people are attached to it. Like, it's like anything to make things easier, but also benefit me. And I like that you're adding in the flavor as well, because it's just like, it adds in that little extra component to it.
Maybe throwing a little sour flavor in there. Who knows?
I'm not a sour person. You can ask George all day. George, I can't do it, man. I'm so.
That changes everything.
You can't put that supplement in at all because of me. No. So it's cool. I think that's awesome what you're doing there. I'm very excited. I want to get you and your partner on as you guys get more involved in it in time.
For sure.
Because I want to do like a follow-up episode where we dive just deeply into that business portion for the viewers, for people that are following along, that are looking for more of the business side of things. So that'll be really cool to see on that end. Go ahead.
No, what I was thinking is do you feel like who are the clientele you feel like you're getting in here for your different IVs? Do you feel like you're working with just mainly bodybuilders, or do you just have like?
It spans very differently, and I think that's I appreciate you asking that. It's more. It depends on what our focus is, right? And I think that's where it comes into play. So I do have some big name bodybuilder athletes that are coming through the doors, which is really awesome to kind of get like that clinical aspect to someone who's like so detail oriented. They're doing everything down to a T, and we're seeing where like which mixtures we're putting together or what infusions that we have prepped up are helping them. So it's giving like good, like real raw feedback from someone who's totally calculated everything they do. But I also get a lot of patients and clients that come through that are just, whether it's general maintenance, they're looking for a little bit of assistance and support when they're going through travels, like if they're going out for business meetings. I get a lot of work professionals that will come in, we'll do a high dose vitamin C to help with immunity. And because even if you unfortunately still get sick after getting the IV, it helps the symptoms a lot, and you're able to still do the work that you need to do during your travels. So I get that general population of people coming through, people that are just looking for like a boost of energy when they're feeling, they're running all the time. Like someone like you, or just a regular busy individual. It's like I worked like 3-4 hard days in a row. I wasn't able to get as much of my diet on point. And they're like, I just need, like, I know this isn't the answer. And I always address that to people, that this isn't the answer to it, but it's something to assist you along the way when you're having those really busy moments and you need something to keep you going. So it's very wide, broad spectrum.
Right.
And
and I feel like just like I said, if it's something, it's a service or product that's available and you feel like it helps you, then why not?
Oh, 100%. I've even used it myself. And I see, like I said, I'm very transparent about it. Some people have reported like right away, they're like, I feel something. I haven't really done that. Maybe once, or it's like I notice a little bit of a difference. Where I notice it more now that I've been doing it consistently is I'll use it. Like I said, I'm one of those people where it's like if I'm feeling a little more run down, I haven't been following things, or I just know I've had like a busy run of days, that's when I throw it in there. I get a nice boost. My sleep and recovery the next few days are like really good. I feel like I'm waking up refreshed. Just that extra little boost to get me through things. And I think where I want to dive eventually more into is going to be the NAD infusions and the glutathione infusions. I've heard a lot of great benefits with antioxidant support. It removes free radicals from our body. That stress for the general pop to kind of know. It's just slowing our cells down, and as we age, we naturally produce more free radicals. So glutathione and NAD kind of tie together, where NAD does DNA repair synthesis, and then it helps the cells just naturally produce energy the same way that creatine would. So it helps with cognition, just overall energy support. And then the glutathione kind of like is the partner in crime to that, because glutathione removes those free radicals on the body that are slowing the cells down from doing what they need to do. I've done that infusion a few times, extremely intense. It's like, so it triggers your sympathetic nervous system, or at least that's the thought behind it, because it's ramping up ATP production. And so you get like almost anybody who's ever had like morphine or CT contrast, you get like a very flush feeling in your chest. You get like redness, and if you run it very fast, you can get nauseous. Really? So it can be a very intense infusion, but like as soon as the last drip's done, you're like, I feel great. Like this is good. Yeah. Because all those symptoms go away. Like, I mean, it is crazy. It hits you, you feel it during the infusion, and then it's gone.
I feel like I need to come back and actually do one of those after a long trip.
Oh, I would love to. Yeah. I like I said, that's, I think, one of the biggest beneficial ones for me. The hardest part of it, and I tell people all the time, is just the price point. It is expensive because it's such a long infusion. It's more of an expensive product. So those are some of the things that I'm struggling with, because my real goal is to get it out to as many people as possible. Right. It just makes it difficult because, so they have to sit in the chair for 2 to 4 hour infusion, depending on how they tolerate it, what dosing they're doing. And then it's like you have the staff that are, working through that. Right now, when it's just me, I'm able to cut some deals, cut some corners, but it's like as I have to step away, I know, unfortunately, I'm not going to be able to do that as much. But that's my biggest, like, I guess, stripe.
I'll just have to come through and do it when I'm like studying for boards one day or something. Like,
superpowers.
Let's go.
Our buddy Colin was like, all right, when am I going to start flying? Like, he was like, I suffered through that way too long. He was like, when are the superpowers coming, bro? Like, when are the Wolverine claws coming out? So that's been a good one. I'm very intrigued to see long term. I've heard a lot of big benefits with autoimmune patients, like actually MS and Parkinson's. It's actually helped. There's this Dr. Conover. He's been doing it since like the early 2000s with the NAD. And he's seen like the patients, like family members will report like after the infusions, they do like a big loading dose, and then they maintenance it from month to month. A lot of improvement in their mobility and like their flare-ups and everything that they got going on. So that I want to dive, like, I unfortunately don't have the time right now, but that's the clinical side of things that like excites me. That's where I'm like, I want to learn more. Like,
Yeah.
where are these other things that we can assist people in doing?
Yeah,
doing
that would
more?
be big.
Yeah. So.
What did I get today?
So we did the Myers cocktail for you. I actually did this for Chaz too. For you, different reasoning, but still all the same benefits. For Chaz, I did it for him because he's, you know, post-show bodybuilding, needing recovery. Myers cocktail is just like an overall encompassing infusion. In your case, I did it more for the first time. It's just something I recommend to everybody. It's a little bit less inexpensive. Get your foot in the door, get you feeling it. You're getting B12, B complex for energy and brain fog. You're getting the vitamin C for some anti-inflammatory and immune support. And I think my biggest one is the magnesium. That, like, the assistance that I get with sleep. I've done it with friends, family, like people just come through the doors. Like, one of the biggest things and takeaways that I get from the infusions are sleep. And it's like you mentioned it earlier with the getting the 8 hours. Like, that's one of the biggest, like, in a society that we have today. It's like we're moving. You're not
you have to
sleep.
like shut it off to go to sleep. It's like sometimes it's like it's so impossible to just like, all right, I can't do any more work. And then it takes me an hour, maybe an hour and a half just to unwind at night, you know?
Yeah. And so this is, I feel like, one of them where it's like people have been like, yeah, I sleep very well. I sleep uninterrupted after I get the infusion. And I even tell people, like, in my own, like, I've been diving into more of like a functional medicine space just because that's kind of where we're going with our direction. And I think a lot of people are looking for, you know, they're looking to take control of their health again. I recommend magnesium, the supplementation, to people as well before bedtime to help with any, if you're having cramps, restless legs, or you just need help with your sleep. Outside of like creatine and getting like your protein, those basic things, like magnesium is one of those top supplements that I will recommend in, you know, people's direction.
Do you have like a stack that you personally take like every single day?
I do. So mine's, I think, a little bit more comprehensive than most. Just, you know, it's just the nature of the beast. I'm super hyper analytical. This is just my space and my realm. The big things that I at least tell people are vitamin D. It's huge, like you said, especially if you're in areas where the winter months come in and they just keep you out the sun. And even people, like, you'll find that I've been seeing, like, I've been hearing a lot of stuff that you're like in Florida, you're in Texas, places where you're like out all day. Those are actually people you find that are more vitamin D deficient because they end up not absorbing as much of the sun and everything. Yeah, because they're out there so often. Your skin is kind of almost like, in a way, I guess, like, for lack of better explanation, fighting against getting all that vitamin D absorption. So, or if you just have gut issues. But anyway, vitamin D, great one. It's just going to help from a hormone side. Then magnesium, like I said, for a lot of people, that one I don't take because I feel like I don't have issues with my sleep. But if I did,
right? Some days I just like go back and
I'm out. I'm gone.
Yeah.
So that's not one for me, but anybody, that's a big one. Fish oils always. It's just going to be beneficial to get that in, help with your cholesterol levels. And then K2. And that's because it's going to assist with the vitamin D, with your absorption. Even when you're taking vitamin D, we see a lot of people will supplement and their levels are still low. They're feeling fatigued. The K2 helps with that absorption. And I always tell people with the fish oil, the K2, and the vitamin D, eat it with a meal because they're, especially the vitamin D, it's fat soluble. So you're going to absorb it better with food. Those are just small little things that'll kind of like make a huge difference when you're rechecking labs and you're like, why is this still low? Those small adjustments are big. So I'd say those three are always big recommendations: vitamin D, vitamin K, and fish oils. If you're doing nothing else outside of like creatine and protein.
Sick.
So cool. Let's see what else we got. I think we'll wrap it up. We got great content. I think we're about at like the 50-minute mark, somewhere close to there. Our 2 points we will touch on. We'll just do a real quick segment about any advice to new current med students. I have 2 questions that I'll throw your way for that. And then we'll just do the wrap-up signature question that I have and an outro.
Cool.
All right. So as we kind of get a little bit further in the podcast, I want to rewind a little bit, get some nice, before we close out for the day. I'm curious, as a new MD, what would be some of your advice to day one Joel going into med school?
Hang on tight, my friend. Just hang on tight because you're in for a ride. I mean, if you want to an easy ride, like medicine's probably not for you. Like, I mean, there's some people that I've met who are extremely gifted and they were born to do this, and those are the few exceptions. But I mean, it was not easy. And I mean, I went to a Caribbean med school, did 2 years at St. Joe's in Patterson, and now, South Jersey at the moment. I mean, took a travel job. I mean, there's just still so much. Have you ever heard of the Dunning-Kruger effect?
Slightly. I heard it recently again.
So like there's a certain overconfidence that people have when they're new at something.
Okay.
Because
yes.
they don't know the depth of the knowledge there is still to know, right?
So, what do you think med students should know that they don't?
Yeah, you guys are going to be extremely, extremely smart. Don't get me wrong, but you got to learn how to apply that knowledge. And there's just so much that you don't know. It sounds dumb, but sometimes you just got to really learn to like shut your mouth and like absorb things. And that's not me being mean at all. That's me like you guys are so smart and probably remember a lot more book knowledge than I do at your stage. But like you guys are so smart, but there's the clinical side of medicine is just so different than the book side. Oh my gosh.
I like that. That's awesome. I think that'll be a good takeaway for some of those people that are just freshly getting into more of the residency side. And like you said, being able to apply it. I think even like from a nursing perspective, we talk about that. It is book smart and clinical smart are not the same in any way, shape, or form. And like you said, the people who are just gifted with logic and thought process and being able to just pick things up from a book, and they just struggle to apply it in the real world. Yeah. So I like that perspective a lot. I would say last question for you from that perspective. What is your biggest lesson that you've learned throughout your residency for yourself personally?
It's a big one. I feel like I've taken away a lot of pearls through residency, and I guess I'll start with when you're busy and you're in the emergency room and things are getting crazy, order more tests for your patients because your mind is most likely not functioning in as focused of a manner as it normally should in a busy ER, so you're going to miss some things. So, add on that troponin even if you think it's just a belly pain, or add on that extra lab or that extra, chest x-ray or something you might not think you need. But, that's one thing. I think when you're burned out, spending more time with your patients, I love that one. I think that's fulfilling because everyone comes from somewhere, and there's something you feel a little bit more fulfilled after speaking with the patient and getting to know them on a little bit more of a personal level. I think that's helped me a lot.
I like that. I think I'm going to cut you off there because I like that you took more of the practical side from the MD and also a little bit of a personal side.
Sure.
And I will wrap up with one of our signature Infuse Conversations questions by asking if you could infuse one rule or broad lesson about health in general in any way, shape, or form into every person, what would it be? It can be mental, physical.
I would say if you don't use it, you lose it. Like someone told me, at one time in your life, you're going to jump for the last time and you won't even know it. And I was like, oh my God. And I was like sitting there, like jumping in place. I was like, it's today. But no, like it's really, you gotta move. Like even if you have joint pain, like you need to move. Like even if it hurts, you need to move. Like it's painful for a reason, like you gotta put in the work. You just gotta keep moving.
Yeah.
You just gotta keep moving.
Yeah. I say all the time, you can tell right away the moment that patients aren't active, they're not doing things in any capacity. Like you said, it's just things go downhill. We kind of lose that drive. I think as people, like you said, we always need to be moving. So that was a great question there, or a great answer, sorry, about I will definitely be jumping around all the time when you leave here now. That's for sure. Definitely a little bit of a big eye opener, I think, for people. So it's a great question. But with that said, that is the end of our episode today. Dude, I really appreciate you coming out. This was awesome. I had a great time. Guys, you can subscribe to us on Spotify and YouTube, Infuse Conversations there. Or if you just want the Golden Nugget clips, the best of the best, we'll be posting those on the Instagram page at the Regenerative Wellness Clinic. You guys can go give Joel a follow for all of his memes and funny moments, all the relatable stuff in the healthcare world at The Real MD. Joel?
Real Dr. Joel.
The real Dr. Joel. Dude, this has been awesome. I appreciate it. I had a great time.
Me too.
I can't wait to get these episodes out. I'm excited. Big things in the future for you.
Big things.
Can't wait. We'll definitely have to do a follow-up episode about all the crazy business adventures you got going on.
I mean, we both have a lot of good, cool stuff happening. So
well, for
that's
sure.
awesome.
But, I'll definitely get you on, hear your portion of it. I think a lot of people will be interested, especially with your background and your education and everything as a doctor. So I appreciate it.
Thanks for having me.
Of course. We'll see you guys on the next episode.